Hello, everyone. My name is Mohamed Rashid. I'm the head of WASH Department for Action Against Hunger. I'm also joined by my colleague Bizuneh Assefa, who is the regional WASH specialist based in Nairobi, Kenya. And today I'm going to be presenting multi-sectoral and coordinated cholera response in the fragile context within Somalia, particularly focused on the cholera outbreak in 2022 in Baidoa. To provide a brief synopsis on Action Against Hunger Somalia process, we have started operations in 1992 with our thematic sectors being WASH, health, nutrition, and also food security. Action Against Hunger is a member of the BRICS, SOMREP, and the Bridge Consortium, and is leading AFMAT Plus Consortium. We also have 5 local partners who we are collaborating in terms of ensuring that we are able to provide life-saving services in areas that are hard to reach. To provide a brief background in terms of the cholera situation in Somalia, cholera has been endemic in Somalia for the past 3 decades, and this majorly associated due to poor access to water, sanitation, and also poor hygiene practices, which is also exacerbated by limited access to healthcare facilities, especially in locations that are hard to reach. In 2022, during the period of April to July 2022, we have had a cholera outbreak in Baidoa, and this was majorly associated due to water quality issues, particularly in some locations within Baidoa. Water quality analysis that were conducted revealed that there was presence of fecal coliforms in the sample, the water that was analyzed, and we have had to almost manage close to 2,345 cholera cases at the CTC managed by Action Against Hunger, and the case fatality rate was 0.47%, which is below the SWIA standard of 1. The total deaths that were documented during this period between April to July 2022 were 11 deaths. If you look at the map in terms of the mapping of the AWD cholera cases in Somalia, especially for the projections done for 2024, you see there are a number of cases measured in Banadir Bay and also in Lower Shabelle, and by extension, some of the locations that are hard to access limitation is an issue. To also provide a brief snapshot of the national AWD cholera outlook, for the past week, we have had 630 new cases, where 55% of these cases were children, and 5 coming from 28 districts, and 3 deaths were also documented. Cumulatively, 7,235 cases were reported during this year, and most 58% of these cases being children under 5, and cumulatively the CFR for the entire year is standing at 1.3% as per the national CITREP. In terms of also providing the national outlook per district, with our focus being Baidoa, we have reported 21 cases during the week of 13, and also 26 cases cumulatively for the entire week since the start of 2024. We have had 276 cases with 0 deaths, and the CFR being managed at 0%. There are locations, especially locations that are hard to reach, particularly in Kuntawari, which is a location that's not accessible to the humanitarian agencies, experiencing spikes in terms of cholera outbreak, and majorly also in Bosaso and Garowe, where we have had 69 and 131 cases respectively during this period. In terms of the multi-sectoral response to be able to contain the cholera outbreak in Baidoa, we have had to ensure that we closely collaborate between the health, WASH, and the CCM cluster. In terms of health, we ensured that we activated the cholera task force and operationalized the CTC managed by ACF, and also 45 ORP facilities through the different health partners. And in these facilities, both the ORP and the CTC, we have managed to treat 5,200 children who are majorly susceptible to these cholera cases. We have also trained 44 community health workers on case management and also referral of cases. We have also closely collaborated and coordinated with WHO and UNICEF to ensure that we are able to provide essential medical services at the CTC level. And we have also conducted health education messaging to ensure that these preventive measures for AWD and cholera are aired, and we have reached 468,000 individuals. In terms of the wash front, we have managed to chlorinate 604 water points within Baidawa district through the collaboration of the different wash partners. We have managed also to set up a wash minimum at the CTC level and conduct the distribution of wash supplies, majorly in terms of jerrycans, water treatment kits, and multi-purpose bar soaps, especially targeting cholera hotspot locations within Baidawa, and also utilizing the wash core pipeline in terms of reposition essential water supplies. In the CCM sector, we have ensured that we are able to map out the different services provided by the humanitarian agencies present in Baidawa, ranging from wash, health, nutrition, and also protection. If you look at the map, this is where we have ensured that we identified the water points to ensure that we were able to conduct routine chlorination of these water points throughout the cholera outbreak period in Baidawa. The Action Against Hunger has also a operational cholera kit where we have trained both health actors and the wash partners in terms of ensuring that we were able to contain the cholera outbreak in Baidawa within a 3-month window. And we have also deployed a surge team to support the Somalia National Wash Cluster in ensuring that all the cholera response activities were streamlined and well coordinated, and ensuring that we were able to reposition wash and also medical supplies at the CTC level. The wash response, I think, was very pivotal in terms of ensuring that we were able to reduce the cases at the community level, in ensuring that we were able to scale up the wash response, particularly in ensuring that we provide clean and safe water for these communities. The operational cholera toolkit has 5 modules ranging from coordination, cholera case management, cholera response in the community, assessment, monitoring, and evaluation, and learning. And the learning we have learned back in 2022 are still the lessons we are utilizing during this period, where there is anticipated spikes in cholera cases, particularly in Baidawa. And finally, in terms of support functions, whether it is logistics, human resource, and also communication aspect. And the tool is very, very rich in terms of ensuring that cholera minimum response is streamlined well across the different sectors. The key lessons we have learned from the cholera outbreak in Baidawa in 2022, we were able to closely coordinate with the WASH actors in ensuring that we coordinate the WASH response at the community level, particularly targeting locations that were hotspot for these cholera cases. Then the CHWs were also pivotal in terms of ensuring that they were providing essential role in preventing cholera illnesses and deaths among medically underserved population, particularly in locations that are hard to reach. And then at the CTC level, we were able to learn the aspect of prioritizing crowd control and enforce a policy allowing only one relative per patient. And this has also played a key role in ensuring that we break the transmission chain within the CTC level and fully activated the IPC measures at the CTC level. And finally, one of the lessons we have learned is the strong referral systems between the ORPs and the CTC, especially in involving qualified nurses to administer IV lines and accompanying patients, proved successful in transferring severely dehydrated cases. And there was a standby ambulance in the CTC to ensure that all the severe cases were referred to the CTC and the mild cases managed at the ORP centers. And that brings me to the end of this presentation. And I'm looking forward to the in-depth discussion. And I wish you all the best in the next few days so that we will going to have a detailed and in-depth discussion of WASH or other emergency-related concerns globally. And thank you so much and wish you all the best. If there are questions or comments, I'm ready to respond. And I'm also joined by my colleague, Bizuneh Assefa, who is the regional voice specialist, and we are more than ready to provide any clarifications and also respond to any comments or questions. And thank you so much.